this is Dr Ekawali, Consultant Obstetrician and Gynecologist, Motherhood Hospital, Mohali. And today we'll be talking about everything and anything you want to know about normal vaginal delivery. What will happen on the D-Day? We are going to discuss everything step by step. So सबसे पहले normal delivery का time क्या है? Any time between 37 to 42 weeks you might go into labor, and this is considered normal term vaginal delivery. What are the signs of delivery or that you are going into labor? You might have contractions जो आपको back से शुरू होकर tummy में आती हैं, and you may feel like menstrual cramps. You might have leakage, which may feel like a constant trickle or a splash of fluid from your vagina. Your clothes may get wet, or there may be a splash, a pool of water on the ground. Thirdly, you may have bleeding. Bleeding may be in the form of pinkish, brownish, mucoid plug, or it may be heavy. In all these three conditions, you need to go to the hospital. Now, when you reach hospital, what will be done? You'll be either received by a staff or a doctor. The doctor will, examine you, take your vitals, check your BP, pulse, check your contractions, and also give you an internal examination. Internal examination में the doctor needs to check कि cervix का, that is the uterine mouth कितना खुला हुआ है, उसका dilatation कितना है, उसका effacement कितना है, baby का head कितना नीचे आ गया है. After that, if you are for admission, if it is not false labor, then the nurse will put in an IV cannula, give you IV fluids, आपको CTG लगाया जाएगा, which will monitor the baby's heartbeat. You may also be given an enema if you had not passed stool that day, and you'll be kept in a comfortable position. Yes, we have some nice music, some nice lights, and ball and rope exercise, some comfortable beds, everything for the laboring women. Now after that, every 4 hourly, your doctor will check how much the cervix has dilated to check the progress of labor. So every 4 hourly, the doctor will give you an internal examination. At the same time, your BP pulse will be checked, and obviously the baby's heartbeat is continuously being monitored. Now, when you come to the second stage of labor, this is the latent phase and the active stage, first part of the active stage. Now, when the cervix is fully dilated, जब बच्चेदानी का मुंह पूरा खुल जाता है, then you are in the second stage of labor. Then your doctor will want you to push. The important things these days is, initially it was wanted that a laboring woman should lie down only. But these days we encourage patients to get in any position they are comfortable. They might try walking, they might try sitting, they might be on all fours, they might just be lying down, bed elevated on their sides, any position which is comfortable for the laboring women. Once the baby's head is crowning with every push, now how does a push or second stage feel like? You'll get a pooping sensation. So once the baby's head is visible on the vaginal opening, your doctor might want to give you an episiotomy, which is a cut on the side of the vaginal wall to increase the size of the vaginal opening. The baby is delivered. Initially baby का head deliver होता है, followed by delivery of the shoulders, and rest of the body comes out. These days what we do is we practice delayed cord clamping. हम immediately cord clamp नहीं करते. We might give it 30 seconds or 1 minute so that maximum blood flows from the mother, from the placenta to the baby. And we put the baby on the mother's chest so that they have a good bonding at that time. We might even start breastfeeding at the same time. After 1 minute, the cord is clamped and the baby is taken by the pediatrician for examination. Everything is, nicely and meticulously examined. Baby ka breathing, heart, toes, fingers, everything is counted and looked for any anomalies. After that, the placenta comes out, and the placenta is delivered, and we look for any bleeding, any excessive bleeding. Then the episiotomy sutures are stitched. They are stitched in layers. You are applied an ointment, you are given some painkiller, and something is brought for you to eat because you have been obviously on liquid diet or ice chips throughout the duration of labor. Then you eat something, and that is the time for you and the baby to bond. So that is how, through the process of normal vaginal delivery, you become a mother. Thank you.